Intermittent fasting has become one of the hottest diet and fitness trends in recent years. But what exactly is intermittent fasting? What are the different methods and how do you do it? We are going to explain everything you need to know to get started with intermittent fasting for weight loss, better health, and an optimized lifestyle. Let's boost those benefits. We'll start by defining what intermittent fasting actually is. Intermittent fasting involves cycling between periods of fasting and eating during set times. This allows your body to enter into a metabolic fasting state during the extended fasting periods. It doesn't dictate which foods you should eat, just when you should eat them. The most common approach is fasting for 16 hours per day, with an 8-hour feeding window when you eat all your meals. For example, you might stop eating at 8 p.m. and not eat again until noon the next day. This is referred to as the 16-to-8 method, and is a great intro to intermittent fasting. And no, you don't have to go full days without food as some people think. The fasting periods with intermittent fasting are usually no longer than 24 hours. What are some of your first impressions or concerns about intermittent fasting? We want to hear from you in the comments. And please, make sure you hit that subscribe button for more healthy habits. Let's talk about different types of intermittent fasting. There are several different intermittent fasting schedules you can follow, depending on your preferences and lifestyle. The 16-to-8 method is the easiest, with 16 hours of fasting and an 8-hour eating window. Alternate day fasting has you severely restrict calories every other day. The warrior diet is a 20-hour fast with one large meal at night. Eat Stop Eat involves fasting for 24-hour periods 1-2 times per week. The 5-to-2 diet has you eat normally 5 days a week but fast 2 days. The 16-to-8 plan or 5-to-2 diet is great for beginners. Feel free to experiment to find the intermittent fasting style that you can stick to long term. Let's discuss the benefits of intermittent fasting. Here are 4 evidence-backed benefits to intermittent fasting. 1. Easier weight and fat loss, without having to restrict calories heavily. The extended fasting periods promote fat burning. 2. Lower blood sugar and insulin resistance. Studies show intermittent fasting can stabilize blood glucose. 3. Increased longevity and cellular repair from activation of sirtuins and autophagy during fasts. 4. Improved mental clarity and focus. Intermittent fasting boosts BDNF, which supports neuron growth, plus benefits for heart health, blood pressure, inflammation markers, and more. Intermittent fasting offers both weight loss and overall wellness benefits for most people. Next, let's look at some tips for getting started. If you want to give intermittent fasting a try, here are 5 easy tips for you. 1. Gradually extend your fasting periods to avoid shocking your system. For example, start by having a 12-hour fast, then slowly increase from there. 2. Stay busy and active to keep your mind off hunger. Hunger pangs often pass after 10-15 minutes. 3. Drink water, herbal tea, coffee, and other zero or low-calorie beverages during fasts. 4. Ease into it. Don't feel that your fasting periods need to be 16+ hours right away. Do what feels comfortable. 5. Pick an intermittent fasting schedule that fits with your lifestyle. The best plan is one you can stick to long term. What tips or personal experience do you have with intermittent fasting? Share your advice in the comments to help others out. We covered all the intermittent fasting basics, from methods to benefits to starter tips. Intermittent fasting is one of the simplest but most effective health and fitness strategies out there when done properly. If you want to try out an intermittent fasting plan, be sure to listen to your body's feedback. Stop if you feel unwell. Stay tuned for more intermittent fasting content. And check our best nutrition playlist as well.